Hi, everyone. Well, we finally got to the US, and this has been the lecture or writing the history of COVID-19 in the US. And this has been the lecture I've been dreading because, of course, writing the history of COVID-19 means collecting primary sources. And the primary sources I've collected, of course, are going to be partisan. Uh, it's just the nature of, as what I'm trying to do as a historian is simply collect information, but to be faithful to the history of COVID-19 in the US, or in other words, to be faithful to the events that began as of January 2020. The documents, the memes I'm going to show you, the videos are partisan. It comes down to a binary of basically referendum of being anti or pro-Trump. It didn't have to be this way, but that's the way it emerged in the US. And so this is, of course, challenging, is, well, without trying to be biased, of course, what information should I include? What do I exclude? And then, of course, the challenge is, am I censoring myself as a way of trying not to be partisan? But then at the end of the day, as I was preparing this lecture, I realized it's impossible. As we proceed, I just wanted to acknowledge that that's a problem I tackled with. But then again, you might very much agree with some of the primary sources I'm going to show you. And the first is a documentary. You might vehemently disagree. But at the end of the day, these were the sources that were created as a result of COVID-19. And so as a historian, I decided that it would be willful censorship, in other words, if I didn't include it. So that's what I'm trying to basically say. I'm going to show one documentary in the beginning that really is a historical document of the evolution of COVID-19 in the US. It's produced by Bloomberg News Agency. And so first I have to kind of call out the bias. And the bias is, remember, Bloomberg ran to be one of the Democrat presidential candidates. So of course, if it's going to be produced by Bloomberg, it's going to have a very anti-Trump slant. Nevertheless, it's important for me to introduce you to this aspect of the course. So let's begin. And there's just so much that happened and so many primary sources that I collected that I have to divide this lecture into several parts. So the first is going to be chronological. And a historian, these are the major junctures of the year 2020. I limited to 10 junctures. And then what I'll do is we will first watch the documentary that gives an overview. So more or less the events from January 2020 all the way to the eve of November 2020. Then what I'll do is show you the sources I collected and divide it into two. Primary sources, digital artifacts I collected until June 2020. So, it's the first 6 months. And then afterwards, digital artifacts from July 2020 onwards. Then I have one thematic lecture. It is on the mask in the American imagination. And then that should round out our lecture on how COVID-19 impacted the US. So each one of these major events, I'll be not so much discussing, but showing you the primary sources that emerged in reaction to them. But before going any further, this is a history of public policy in the US and a history of medical policy in the US, or more accurately, public health policy in the US. But before I could teach you kind of the history of how public health policy is implemented, I have to teach you how does policy get implemented in a cycle. And it's 1 through 6, okay? And this is why I chose this documentary, not for its kind of partisan slant, but because it does a good job of highlighting the policy cycle. So policy in general, but in this case, we're looking at public health policy, begins with agenda setting. And agenda setting is basically when the policymakers acknowledge that there's a problem, and then they start orienting decisions to encourage action. The minute that happened, number 2 emerges, policy formulations. What are the possible solutions? So with number 1, with COVID-19, particularly in the US, the first part is to acknowledge COVID-19 is a threat and it's come to the US and it poses a problem. You have to acknowledge that. Once you do that, the agenda has been set. And then policy formulation are the various solutions. Now with the US it's a bit tricky because you have Washington, DC, and then 50 different states, okay? So this is the various possible solutions. Does DC issue a national lockdown? Well, that's almost impossible in the United States because of the federal structure. Okay. So then the policy formulation has to be implemented by the states. Each state has to decide what the nature of the lockdown they're going to impose and the nature of masks, okay, in terms of are they going to be mandatory throughout the state, only in public places, so on and so forth. The minute you do that, then you have to get the public to accept it. That's called legitimation. Basically, it's in the US, is who obeyed the lockdown orders, who defied it. Anyone who defied it is an indication that the policy did not have legitimacy amongst that demographic. Number 3 is more or less you have to sell the policy to the public. Number 4 is implementation. Okay, what resources and coordinative capacity is at hand? This includes staff, doctors and nurses, buildings. When you have to build temporary hospitals or use refrigerator trucks as morgues, that is a problem with implementation and technology. The hardest part in implementing then COVID policy in the US was getting access to ventilators. All of that was a problem with implementation. Once 1 through 4 has been activated, then as policymakers, you evaluate, is the policy successful? Okay. And then you decide at number 6, do you maintain the policy? Do you continue the policy with a bit of tweaks, or do you end the policy? Okay. And the most easiest way to kind of demonstrate policy number 6 was what was happening in July, the pressure to reopen the economy. That was more or less policy termination. We have to terminate the lockdowns to reopen the economy. At least that was a policy at the White House. So having said that, I'm going to show this documentary and then pause at various moments that illustrate the policy cycle. So I'm using this as a primary source. We have to analyze the date. It was on October 6, 2020. Now this is a product of Bloomberg, the Bloomberg Corporation. Has about 2.6 million views, 51,000 liked it, 2.4 thousand disliked it, because like I said, it is quite partisan, okay? But let's go. It's partisan, but like any historical sources are rarely neutral. Let's proceed.
You have 15 people, and the 15 within a couple of days is going to be down to close to zero.
Okay, already with that voiceover, the partisanship has begun, so to speak, or with Trump saying there's only 15 people and it's going to go down to zero, that is an acknowledgement that, or that's the documentary arguing Trump is not setting the agenda. And already there, you look at this image from Costco. That is one big hefty man in that scooter. Anyway, the rush for toilet paper, or do you see even, it's the Costco staff that's handing out the toilet paper. That is a fight over unnecessary fight. It's not, I'm not sure if it's implementation or legitimation, because remember, implementation is about resources. Legitimation is, do the people accept the policy? Here, the people are panicking about a lockdown. And what's the, what is the rush for? Toilet paper.
Whatever happens, we're totally prepared.
Okay, whatever happens, we're totally prepared. That is arguing that, number one, the formulation is already set. And policy, I shouldn't call it number one. In the policy cycle number two, we formulated a policy, don't worry, and that we have the resources to deal with it. That's implementation.
It's going to disappear. One day, it's like a miracle. It will disappear.
The disappear, again, is arguing that the failure to set the agenda. You're not taking the problem seriously. The woman holding up a sign for PPE, personal protective equipment, that's referring to implementation. Number four, having the available resources to implement the policy of dealing with a pandemic. Okay, right there, those people open up. That is an indication that lockdowns are not legitimate in their eyes, okay? They basically are lobbying for a termination of the policy.
10. I think we've done a great job.
And that's Trump evaluating. That's number 5 on the policy cycle. I give it a 10. I've evaluated. We're doing a great job.
Durante el minuto que dura este vídeo, 40...
You gotta be kidding me. Okay, sorry about this. Because no, I paid for no ads. Oh, damn.
niñas van a ser obligadas a
I have
casarse.
like Amazon, YouTube Supreme.
In the first 3 months of 2020, the coronavirus hit nearly every country in the world. But the United States quickly became the center of the outbreak. We were, and are, number one. Number one in total infections. Number one in deaths. The Trump administration would like us to believe that the coronavirus was unexpected, like a natural disaster or surprise attack. But that's not the truth.
We've had multiple outbreaks with coronaviruses previously. In 2002, we had SARS. In 2012, we had MERS. Both coronaviruses, we know they spread person to person. We know that they can be contagious. So this idea that it came out of nowhere is really nonsense.
We do have a pandemic plan for the U.S.
What we know, what little we know about this coronavirus so far, is that it appears to be spread most often from droplets, say sneezing and coughing.
The president has made clear that we have a responsibility to prepare our nation for future threats.
At some point, we are likely to face another pandemic.
The novel coronavirus is a threat to the entire world.
And likely will come a time in which we have both an airborne disease that is deadly.
The truth is, a major pandemic in the early part of this century was likely.
This administration is constantly acting like it's surprised about the fact that a pandemic spreads across 50 states and kills people. That was what we always knew. I mean, that's why there had been pandemic preparedness plans and planning and exercises and training.
Okay, when she says there's been pandemic plans, preparedness, exercise, and training, basically she's arguing that number two, policy formula, in other words, past administrations had set the agenda by always trying to formulate a policy to deal with a pandemic, okay? This is what she's arguing.
And all the stuff that a federal government is supposed to do to prepare the public and cities and states for what they're likely to encounter if a pandemic hits the United States.
Congratulations, Mr. President.
America will start winning again, winning like never before.
The Trump administration's first real warning came the week before he took office. Obama's outgoing team and Trump's senior staff held a meeting to assess whether the U.S. would be prepared to handle a pandemic.
There's probably 60 people in the room, 30 outgoing officials, 30 incoming officials. We handed them a copy of the pandemic playbook, and we walked through 3 different scenarios.
Okay, so when he's referring to the pandemic playbook, he is basically saying we handed the incoming administration number 2, policy formulation. If a pandemic were to occur, this is what needs to be done. In other words, we've already formulated the policy so that if a pandemic comes, you won't have to kind of react quickly. We've, based on experience, have everything laid out for you.
Of what could happen. One was a hurricane, one was a cyber attack, and the third was a pandemic. And those 3 scenarios were chosen because those were considered the most likely.
The group determined that shortages in PPE and medical supplies like ventilators would make it hard to contain an outbreak of an infectious respiratory disease.
And then as a result of that, there was a series of documents that was given to them, including a pandemic playbook that spelled out really step by step how to deal with that crisis.
Within his first 100 days in office, Trump was briefed on the pandemic playbook, which represents years of institutional knowledge. Trump was also given the CDC's pandemic influenza plan. Its warnings were again clear. There are critical shortages in national supply stockpiles. Over the next 3 years, the warnings kept coming.
Okay, if you have a reference to kind of critical supplies being low in the national stockpile, that is a warning that when it comes time for implementation, there will be problems because you don't have the resources.
So, you took my masterclass and learned to make egg toast really
Ridiculous. I paid for premium. There's no reason why I should be having ads. My apologies.
good. Delicious.
But the White House did nothing.
If we look back in American history, it is close to impossible to find an example of a president who so disdained expert opinion and good advice.
One of the signature features of this administration has been a mistrust of expertise, a mistrust of the career professionals in the government. That has been true across the State Department, the intelligence agencies. Why that is and where it comes from, I will leave to political scientists to discuss.
For 3 years, the White House had been ignoring warnings from experts and predecessors. It had also been dismantling the federal system designed to protect us from global pandemics. That system is made up of federal agencies that work together across 50 states, and it needs resources, coordination, and good leadership to function well during a fast-moving outbreak. On his second
All those agencies, that's the agencies that do the implementation of policy. CDC, for example, Food and Drug Administration.
In full day in office, Trump put in place a federal hiring freeze. Critical government positions in the federal pandemic response system remained vacant. Some for months, others for years. "18 months into office, Trump had only appointed 25 of 83 science-based positions. Trump also pushed out his most senior pandemic experts.
You're fired. You're fired. You're fired. I'm a business person. I don't like having thousands of people around when you don't need them.
Tom Bossert, the president's Homeland Security advisor, had pressed the White House to develop a thorough pandemic strategy. In April 2018, Bossert's team was eliminated and he resigned in protest the next day. Tim Ziemer, the director of the National Security Council's Global Health Security and Biodefense Unit, was considered the top White House official in charge of the U.S. response to a pandemic. In May 2018, Ziemer, who had served both Bush and Obama, was demoted. His team was dissolved, and he later resigned.
And you've got...
Okay, so the argument is basically then what is happening? You're depriving the government of expertise, or you're depriving the government of the experts who could formulate policy, number two, and then the experts who could implement policy, number four.
A president who's denigrated career officials as the deep state. He's forced many of them out. He's silenced many of them. And he's appointed people to run these agencies, people who owe their loyalty strictly to him and who have no incentive to tell him the truth. And when you have the combination of those two factors, that's difficult to run government even in the best of times.
Nowhere was Trump's distrust of expertise and institutional knowledge more apparent than in his approach to the CDC. The CDC leads U.S. pandemic preparedness and response. It tracks and studies infectious diseases, and it works with other agencies at the federal and local levels to respond to outbreaks and keep the public informed.
The role the CDC plays is they go out immediately, they talk to people that are sick, the people that are caring for them, the public health officials, and then they try to figure out if there are patterns. How infectious is this? How long does this take to spread? They put out reports. They give out suggestions, policy recommendations. Those are all the things that a functioning CDC does. And they do it very, very well with good leadership.
In every year he's been in office, Trump has called for CDC budget cuts bigger than any presidential proposals in more than 2 decades. He proposed deep cuts in 2017, in 2018, in 2019, and even in 2020, in the midst of the pandemic. None of these got through Congress, but he had other ways. In 2018, Trump successfully reallocated more than $260 million from public health programs to a program called Unaccompanied Alien Children.
Budgets are a reflection of our society's priorities, and when you've got a president who has consistently tried to cut spending on public health, that demonstrates that it's not a priority.
Trump also removed the Strategic National Stockpile from the CDC's oversight for the first time in 20 years. The stockpile is a repository of critical medical supplies for when states run low in emergencies.
One of the many reasons for the bungled response and the poor preparedness for this pandemic was that sometime in 2018, the Strategic National Stockpile was moved from CDC's management to Washington for so-called efficiencies.
The CDC's presence in hotspot countries like China is particularly important. The agency is our eyes and ears on the ground. Over the last 3 years, the CDC team based in China shrunk from 47 staffers to 14. And in September of last year, our blind spot got even bigger. The Trump administration ended a $200 million pandemic early warning program called PREDICT, which focused on monitoring emerging diseases in China and other high-risk countries.
There's a phrase, a drop of prevention is worth a pound of cure. And that's exactly the case here.
Okay, so with the national stockpile and cutting funds for PREDICT, this is an argument that basically PREDICT was an organization meant to set the agenda. In other words, predict an incoming new pathogen, a potential pandemic, and then warn so that the agenda could be set. In other words, by cutting financing for the CDC or the PREDICT program, all of this would have hurt number 4, the implementing bodies of pandemic policy.
Have been for the past few decades working towards a better global system of identifying threats early on and notifying everybody when those threats happen. It's very similar to an alarm system in your house. Very recently, we've been basically dismantling that alarm system piece by piece. And when you do that through eroded relationships and slashing budgets, what that causes or allows is viruses like COVID-19 to go unchecked. And now they're on your doorstep and they can wreak havoc in a way that they otherwise couldn't.
With the growing threat of a highly contagious virus, the country needed a president who values scientific expertise, who pays attention, who plans ahead. But we were out of luck and utterly unprepared as the worst global outbreak in a century was landing on our shores.
Let me show you how to create an amazing ad using stock footage. Go to artgrid.io. Look at all this great footage. It was always a challenge for me to create a
I don't know if you guys remember where you were in 2020, all the plans you had, the aspirations in January 2020. Well, this is a good blast to the past.
By the first days of January, experts around the world were learning of a mysterious virus coming out of China.
The disease could be contagious.
Symptoms similar to pneumonia.
The WHO not ruling out a coronavirus.
It was an entirely new, highly contagious strain of coronavirus, many times more lethal than the common flu. And there was no vaccine.
It's odorless, you can't see it, you don't know how it kills. How it kills is absolutely terrifying because it takes hold of your lungs and you're basically suffocating.
China's health commission is warning the ability of the deadly coronavirus to spread is getting stronger.
Spreading across Asia.
The virus has now reached Europe.
This virus is going to spread and spread quickly over the next week,
with an increasing number of patients confirmed across the globe.
It wasn't a question of if it would hit the U.S., but when. In the face of a pandemic, there's a critical window to act. If you miss it, containment becomes exponentially more difficult.
Look what he said, there is a critical window to act, or in other words, there is a critical window to set the agenda.
This disease was spreading and doubling roughly every 3 days in the US in the early part of the pandemic. That means that, within a week, it's, times 4, it's 4 times bigger. Within 8 weeks, it's now, if you multiply that out, it's about 100,000 times bigger or more.
If you lose the early ground game and community transmission gets underway, it gets enormously harder to use the tools of testing and contact tracing to clamp down transmission.
Between January and March, we had a chance to contain the virus. We had the experts, we had the resources, we had the playbook. But we needed swift, coordinated action and a real leader
Multiply that out, it's about 100,000 times bigger or more.
If you lose the early ground game and community transmission gets underway, it gets enormously harder to use the tools of testing and contact tracing to clamp down transmission.
Between January and March, we had a chance to contain the virus. We had the experts, we had the resources, we had the playbook.
In other words, we had the experts, in implementation, we had the resources, implementation, we had the playbook. That's formulation, technically 2, and then experts and resources is 4. Okay, but that more or less is arguing in terms of the policy. The American state had the capacity to deal with this.
But we needed swift, coordinated action and a real leader at the very top. Throughout January, more than a dozen presidential daily briefings warned Trump about the threat. Trump's administration should
In other words, warning about the threat, setting the agenda.
be building a massive testing and tracing program and making sure we have enough supplies. It should be coordinating a 50-state response. But in times of crisis, Donald Trump has his own playbook. Deny.
It's a whole big fat hoax.
Distract.
We now call it Spygate.
Politicize.
I hate the children being taken away. The Democrats.
All of this is basically arguing failing to set the agenda.
Have to change their law. That's their law.
And in January, Trump's denial is on full display.
We're in great shape. We have it totally under control.
He is refusing to take the pandemic seriously, and his people are falling in line.
By ignoring it, the way a pandemic works, it's like you're watching a Category 5 hurricane offshore, and you're just going like this.
With cases starting to climb around the world, the full month of January passes without any real action from the administration.
We think it's going to have a very good ending for us, so that I can assure you.
In the absence of a vaccine, the single most important tool for defense is testing. It tells you how the virus is spreading, who needs to be isolated, and where to send extra supplies.
So there were a number of delays that happened. The first was that we decided to use a American-made testing protocol versus the existing one that was already ready to go, made by Germany.
But right away, there's a problem. The American-made tests are defective. Trump has options. He can immediately request testing kits from the WHO. He can mobilize private sector labs, which are eager to make their own. He does neither. And the clock is ticking.
If we had taken that German test and gotten it out there with contact tracing, we would not have had to shut down the country.
Meanwhile, the White House is desperately trying to sell the public on a fantasy.
Well, we pretty much shut it down. A lot of people think that goes away in April.
We have contained this.
This president has this under control.
Because of all we've done, the risk to the American people remains very low.
Okay, this is, I pay for Premium Prime. I shouldn't be having ads. I was in Spain not too long ago, so, that's why the Spanish ads are coming, but, basically, I'm gonna let this ad play for a reason. It deals with what are some of the other problems in dealing with anthropogenic security, right? Mass farming, okay? You see here, industrial farming. Here you get a good idea of it. Of when we say mass farming, what it looks like. Okay, let's get that. No time to sign. You shouldn't be even giving me these ads. Stupid people. Anyway.
A ninth person has tested positive in the UK.
66 more people are now confirmed to have the virus.
Those infected in Hubei has soared by almost 15,000.
From cases worldwide at more than 43,000.
And if the world doesn't want to wake up and consider this virus as public enemy number one, I don't think we will learn from our lessons.
Despite the growing concern, Trump has other priorities. Just days after the WHO's stark message, Trump hits the campaign trail for the first of 6 rallies over the next 3 weeks, where he barely mentions the virus.
The best is yet to come.
By late February, Trump has said nothing about death rates, social distancing, or shutdowns that will soon impact Americans.
In other words, late February failed to set the agenda.
But a preview is playing out overseas.
Yesterday, 2 Italians were the first Europeans to die from the virus.
Italy starts locking down. Doctors warn Americans the virus could hit us even harder, and soon.
The only way to prevent a healthcare system collapse is to enforce a lockdown as soon as possible.
Top White House advisors are scrambling to get the president's attention.
And this is, by the way, why we implement lockdowns. Of course, immediately it is to prevent the spread, but it all has to do now you've learned with number 4, implementation. You see, there aren't just simply not enough hospitals with ventilators to take care of people who have severe reactions to COVID-19. Lockdowns are to not overwhelm the hospitals. It's all about implementation. It's all about number 4.
They know that without adequate testing, social distancing and lockdowns are the only ways to slow the outbreak. They need to convince Trump to prepare Americans for drastic measures. February 14th, the National Security Council sends a memo warning of widespread closures and isolation, which Trump ignores. February 21st, top officials schedule an urgent meeting with the president to push for aggressive social distancing and fast. But it never happens. February 25th, a top CDC official gets Trump's attention, publicly contradicting him.
I understand this whole situation may seem overwhelming and that disruption to everyday life may be severe. But these are things that people need to start thinking about now.
Okay, what is that CDC official doing as a public health official? She knows people have to be prepared. She's getting people ready to be, for the sake of legitimation, that the public accepts these measures. Every time I'm mentioning the word public, right, by the way, you should be trained by now. You're realizing I'm referring to the masses. Okay, this is what we mean by this modern pandemic.
The stock market goes into freefall. Furious, Trump puts Mike Pence in charge of the coronavirus task force. It's a move so abrupt that top White House staff hear about it for the first time on TV.
And we will get through this together. Thank you, Mr. President.
More than 3 weeks will pass before Trump calls for social distancing measures. Experts.
Okay, more than 3 weeks will pass before social distancing measures. In other words, 3 weeks, the agenda hasn't been set, and social distancing is the formulation. Number 2, you're formulating the policy. What needs to be done? Social distancing. And now the hard part, getting the people to accept it, legitimation.
Will determine that if he had implemented these measures by March 2nd, if he had listened to his own team, 90% of the deaths in the U.S. could have been prevented.
Everybody's complimenting me, saying, thank you very much, you were 100% correct. And so far, we have lost nobody to coronavirus in the United States.
So everyone's complimenting me 100%. That's him giving himself number 5, the evaluation.
United States. Nobody.
Tonight, the governor of Washington declaring a state of emergency.
Breaking news. The first death from coronavirus here in the United States. A man in his 50s dying in Washington state.
We live in strange times. The housing bubble burst, rise of China, and the rise of inequality. Health is a very big deal. Taxes are a front-rank issue. Blue-collar.
In early March, the message coming out of the White House starts to change.
Now we're shifting into a mitigation phase. We don't have enough tests today to meet what we anticipate will be the demand going forward.
But Trump is doubling down.
The Obama administration made a decision on testing that turned out to be very detrimental.
Now the Democrats are politicizing the coronavirus. You know that, right? Coronavirus. And this is their new hoax.
His priority isn't American lives, but how the economy looks in an election year.
I think where these people are flying, it's safe to fly.
Some of them go to work, but they get better.
If it were up to the doctors, they may say, let's keep it shut down. Let's shut down the entire world. Because again, you can't do that with a country, especially the #1 economy anywhere in the world, by far.
This was a president seeing the warning signs of a pandemic, 9/11, and telling the American public the opposite. Telling them to go on with their lives, telling them it was contained, telling them that they didn't need to change their behavior, right? And you think of all the things that were happening during that period, from travel, from large gatherings. The Mardi Gras was allowed to go forward in late February when San Francisco was already thinking about closing up. I mean, that to me is the malfeasance that's unique to this administration's response.
He's also promising a warp speed timeline for a vaccine without any basis in science.
Are they going to have vaccines, I think, relatively soon? Over the next few months, you think you could have a vaccine?
Certainly, for sure, a vaccine is not going to help us now, next month, the month after.
Meanwhile, the need for supplies like ventilators and PPE is getting more dire by the day.
Healthcare workers afraid they will have no way to protect themselves.
I've got my mask and I'm guarding it with my life because it could be my life.
But Trump doesn't seem worried. Just a few weeks prior,
Now remember, masks are all number 4, implementation. To implement all this policy, you need to have masks, okay, for the doctors, for the essential workers.
The U.S. exported 17 tons of medical supplies to China.
We could have required that U.S. manufacturers make more PPE sooner. We could have mandated that we start recycling PPE. There is a national stockpile, and there's a lot of debate about how that national stockpile should get used. What should have happened is that stockpile should have gone immediately to the cities in most need.
So you basically had January, February, maybe mid-March, 10 weeks in which you're not doing anything, right? As a government, you're not preparing your first responders. You're not protecting your medical community. You're not talking to governors and mayors that they should begin to close things down. And you're not communicating to the American public, you know what? This could be really bad.
Trump has other concerns.
The Grand Princess today finally slipping under the Golden Gate Bridge and into San Francisco's harbor.
The first week of March, Trump learns that a cruise ship off the coast of California has infected passengers, and they're desperate to dock. He wants to keep them on board.
I like the numbers being where they are. I don't need to have the numbers double because of one ship. That wasn't our fault.
And his administration is still misleading the public.
Anybody that needs a test gets a test. They're there.
People should not say if you want a test, you go get a test right now.
Well, when people need a test, they can get a test.
I still do not have a rapid diagnostic test available.
We have always been able to meet the full demand.
We've underinvested in the public health labs.
There aren't enough people to
There's
run
not
the
enough
tests.
equipment, there's not enough people.
They're testing 10,000 a day in some countries, and we can't get this off the ground. This is not good.
You have the President of the United States saying anyone can get a test who wants one. You have the New York State Department of Health saying only patients who be admitted to a hospital can get a test, because we were so short at that time that The entire New York City area was relying on one laboratory in Manhattan.
Trump is also hammering the comparison to the common flu.
View this the same as the flu. People die from the flu.
It is 10 times more lethal than the seasonal flu.
There is a conflict in messaging. There is a difference in messaging between what our elected officials are saying and what the scientists and doctors are saying. And then the public ends up getting very confused about who it is that they can trust.
But at this point, many Americans are taking matters into their own hands.
Shoppers are finding empty shelves, long lines, and limits on purchases.
We're finding examples where bottles like this are going for more than $50.
Hit the world. And we're prepared, and we're doing a great job with it, and it will go away. Just stay calm.
March 11th, the WHO announces that COVID-19 is now a worldwide pandemic.
We're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction.
By spring break, there are still no national social distancing guidelines in the U.S., and Americans are left to operate as normal.
If I get corona, I get corona. At the end of the day, I'm not going to let it stop me from partying.
The party bra, that's a failure of legitimation. In other words, the government hasn't communicated the severity of the disease to the masses, particularly this guy, woohoo, on spring break in Florida.
But the truth is, normal is long gone.
The lights have gone out on Broadway.
The NBA has suspended the season.
The NCAA tournament has been canceled.
Owners are doing what they can to stay afloat.
Millions of college students have been sent home.
The number of cases soaring,
Overwhelming the city's hospitals.
Doctors and nurses are getting sick.
I don't know I'm even going to make it.
This is a war zone.
Patients keep coming.
One official calling it a disaster that will define a generation.
Hola, me llamo Diego Catalán y soy pintor, dibujante y profesor de anatomía artística. Mi obra se centra principalmente en el retrato y me fascina el mundo de lo fantástico y el terror. Esta mezcla hace que mi trabajo sea muy ecléctico y difícil de clasificar.
You can lie and you can tweet the wrong things, but every community across America is suffering from a pandemic.
There's no end in sight to the health crisis.
At least 9 states report record increases in cases over the past 3 days.
The President of the United States still does not have a plan for turning this around.
At first, Trump blamed China.
China virus, or whatever you want to call it.
Then Obama. But in the spring, he found a new target, the states.
That we direct a statewide order for people to stay at home.
You've suggested these governors are at fault. What more in this time of
Well, I think we've done a great job. We will hold the governors accountable. He's got you in a shutdown still.
This gave him cover to push for reopening without a national plan for containment.
President Trump is pushing ahead with his plan to reopen the country.
The greatest economy, the history of the world, and we closed it.
Trump announced that the 6-week-long restriction will not be extended.
The moment you stop doing the only thing that's working, of course the virus is going to start spreading again.
This guaranteed the painful cycle we're experiencing now. Open up, close down. Open up a little more, close down.
It's just really frustrating.
When we look at other countries that have been successful, kids are able to go back to school. Businesses are able to reopen. We know that public health is the roadmap to economic recovery.
In Germany, Chancellor Merkel's clear, consistent messaging was critical for its countrywide contact tracing program. In South Korea, the government's coordination with the private sector helped ramp up nationwide testing early and swiftly. In New Zealand, Prime Minister Ardern's strict national lockdown helped stop the spread of the virus in its tracks.
We have no new cases today.
By June, almost every other country was bending its curve. Cases in the U.S. at that time were surging. Nearly 200,000 people have died of COVID-19 in the U.S. alone. That's 3 times the American casualties of the Vietnam War, and over 60 times the death toll of 9/11. More Americans have died since February than in any 7-month period in U.S. history. And there's no end in sight.
They are dying. That's true. And it is what it is.
This is also what makes it a historical document. Well, because look at the sentiment. There is no end in sight. Well, back then in October, give it several months later, there is an end in sight, at least with the vaccination. This is what makes it a historical document, this documentary. It's not called a documentary for nothing. It reveals the desperation at that time. And it's a documentary. It serves as a historical record of various statements made by the president during those times. It preserves them. A document like this preserves them. It's a primary source, of course, but it's a primary source that reflects very much a Democrat, liberal media, Bloomberg perspective. I have to admit that.
The ultimate responsibility of the president of the United States is to safeguard the well-being of the American people.
The casualness by which this president is willing to accept American casualties, you sort of can't get your head around.
All the sacrifices that people have made, all the pain and suffering and death, it didn't have to be this way.
Donald Trump was elected on a promise, one that only he could deliver.
This American carnage stops right here and stops right now.
But then came the virus, and with it, the undeniable truth. Faced with the biggest health crisis in a century, we have seen what Trump's leadership means for America. And we have paid the price with our jobs.
We let go 90% of the staff.
With our futures.
Nurses are not being protected.
With our lives. Tragedy was avoidable. Leadership matters. When you vote, remember that.
And of course, that's also what makes it a historical document in the sense it's embedded in a particular period in time right before the US elections of November 2020. But like I said, it was partisan, but it did help me. It did serve as a valuable primary source where I could explain how policy works, okay? And so more or less, what did this documentary do was give us a history of American public health policy. Now, we will then now look at the digital primary sources, primarily means, if we're going to produce a mimetic history of COVID-19 in the US in the next part of this lecture. Thank you.